Hi, I'm Hazel Dukes, and you are watching the 85th Annual New York State Convention.
With COVID-19 vaccines now being administered from Pfizer, Moderna, and Johnson & Johnson, it has never been easier to get a COVID-19 vaccination in New York. However, the Black community continues to express safety concerns with the vaccine. Can we trust the information being distributed about the COVID-19 vaccine? Our health chair, Lorraine Brathwaite-Hart, and her guest, Dr. Wayne J. Riley, will discuss myths versus facts in her health workshop. Hi, Lorraine.
Good morning, and thank you for taking the time to attend the health workshop. Today's workshop will focus on the COVID-19 variants and the urgency for vaccination among the skeptics. The National Association for the Advancement of Colored People, NAACP, is dedicated to ensuring equal political, educational, social, and economic rights for all persons and to eliminating race-based discrimination. This mission includes a focus on the right of African Americans and other people of color access to timely, quality, and affordable health care, and to have optimal health outcomes. As people of color continue to suffer the highest incidence, prevalence, and mortality rates from chronic diseases like cardiovascular disease, diabetes, and obesity, and HIV/AIDS, and our community continues to be plagued by the disproportionate devastation of the COVID pandemic, it has become imperative that clergy, community-based organizations, and trusted voices join forces to continue the campaign of education and awareness in communities of color where the rates of vaccination are low. Data shows that health disparities, example poverty, environmental hazards, education inequalities, language and cultural differences, are long-standing systematic barriers to health care, which overwhelmingly impacts individuals' health and well-being across racial, ethnic, and socioeconomic groups. The top chronic diseases most commonly impacted are conditions that statistically impact the Black community at higher rates, including arthritis, COPD, asthma, diabetes, high blood pressure, and heart disease. The COVID-19 pandemic has further widened the health disparity gap. Considerable evidence shows that African Americans have experienced higher rates of COVID-related infections and deaths, greater food insufficiencies, inability to pay rent and afford usual household expenses, as well as unemployment than any other ethnic group during the pandemic. We will have a chat with our keynote speaker, Dr. Wayne Riley, president of SUNY Downstate in Brooklyn. Dr. Riley, could you give us a little bit of information on your background?
Great. Well, good morning, Lorraine. Delighted to be here with you and the New York State Conference of the NAACP, and a salute to Dr. Hazel Dukes. She's been a tremendous warrior in this war against the pandemic, as well as all of you. So I am a general internist by training. In other words, I'm a doctor who's been trained in the care of adult patients. I now have the wonderful honor of being president of SUNY Downstate Health Sciences University in central Brooklyn, as you know, Flatbush area. We have about 5,000 employees, 2,000 students. We are the only academic health science center in Brooklyn. And more to the point germane to our conversation is during the height of the pandemic, the then Governor Cuomo designated our hospital, University Hospital Brooklyn, as the only COVID only hospital in the entire state of New York. So we were battling on the front lines dealing with COVID. I'm originally from New Orleans, and I'm a proud graduate of the Morehouse School of Medicine, so I'm a good old HBCU product as well.
Great. So, this is an opportunity for us to hear from you now on your overview on the pandemic that has been plaguing us, the country and the world, for the last 21 months. What is your view of where we've come from and where we are and heading to?
Well, that's a question I get all the time, Lorraine, from patients, my own faculty employees, community leaders, where we are now is something none of us could have anticipated. If you think about it, our life changed so much over the last 21 months because of a worldwide pandemic, a pandemic that has sort of visited our shores, if you will. That's been terribly difficult for everybody. It's been more difficult for underserved communities, Black communities, brown communities, Native American communities around the country. More specific to New York State and New York City, obviously, is that we've had a lot of loss because of COVID. COVID has ravaged the Black community in Brooklyn, in the Bronx, Queens, and we have challenges right now. Mm-hmm. As we sit here, in the early fall of 2021, we approach the end of 2021. COVID is still a problem, and we need to redouble our efforts to get more Black and brown citizens of New York and indeed the whole country vaccinated. Lorraine, I'm going to make a very simple statement that I've often said. Look, Black lives matters, but science matters to Black lives. And so that's the context in which I want to have this discussion, is to deal with the science, the skepticism, the history of African Americans and their, what I refer to as their approach avoidance about dealing with people like me, doctors, or the healthcare system in general about anything. And so, yes, we have a right to be skeptical. And you and I were talking earlier about the skepticism that African Americans, some of us have about medicine and healthcare and the whole healthcare system. And we have a right to be skeptical. If you think back, during slavery, we were experimented upon. We were not treated for our medical conditions by slave owners. Or in some cases, slave owners sold us off to be experimented on by physicians. So that's contextual. I understand that. Secondly, we know about the great contributions of Henrietta Lacks, and that a Black woman in Baltimore whose cells from her cancer were used after her death to generate more medical research with no attribution to Ms. Lacks, no compensation for her cells. And she's gone on to save millions of people around the world just because her cells were then used to produce medicines and so forth. We know that history, and that's clearly something we feel very poorly about and are angry about, and so we're right to be angry about that. And then we get to the Tuskegee syphilis experiment, which is, again, I tell people our history is complicated as African Americans. There's a lot of mythology about the Tuskegee syphilis experiment that unfortunately has been called as to justify not participating in vaccine programs. Well, let me tell you about Tuskegee, because sometimes we don't understand really what happened at Tuskegee. Tuskegee, there's a big mythology that the United States government, in the form of the CDC in the 1930s and 40s, gave Black men syphilis in rural Alabama. Lorraine, that's not true. The United States Public Health Service found men with syphilis, approximately 350 men in rural southern Alabama who had syphilis, but they never treated them for syphilis for 40 years. That was the unethical part of Tuskegee. They found these men with syphilis, but did not treat them. Mm-hmm. So I want people to understand, it's not that our government gave those men syphilis, because that's part of the vaccine hesitancy we're hearing, is that I don't want to take the vaccine because they gave those men syphilis down there in Alabama. They did not give those men syphilis. And the other part of the history of Tuskegee is Black nurses and Black physicians were part of Tuskegee. The Tuskegee syphilis experiment would have never taken place had it not been for Tuskegee Institute, an HBCU, that lobbied the CDC to put that study in Lowndes County, Alabama. So again, our history is complicated, and so we can't draw incorrect conclusions about those very unfortunate historical realities into 2021 when we're trying to save lives in terms of vaccines. So these vaccines are safe. Everybody in my family generally is vaccinated. We have one or two members of my family who are still a little resistant. I'm still talking to them. I'm answering their questions. I'm not challenging their intelligence, but I am sharing data. I'm being factual. I'm dispelling myths, half-truths, mistruths, whatever. And as I jokingly say, everybody's got a cousin Pookie who opines about everything. But look, this is one of those things where we have to understand COVID is a deadly disease. This is worse than the flu. It's worse than any other infectious disease that I've treated patients in my whole medical career. And the vaccines are designed to do 4 simple things, Lorraine. Number 1, keep you out of the hospital. Number 2, if you go in the hospital, keep you out of the ICU. If, God forbid, you go in the ICU, the third thing it does is it tends to keep you off the ventilator. And more importantly, Lorraine, it keeps you out of the funeral home. That is the best way I can elucidate why every black person, every African American, Afro-Caribbean in New York City and New York State should get vaccinated. Those 4 reasons. So I'm anxious to have dialogue with you about all of this.
So much to unpack. And I need to go back to the syphilis study because it's imperative for the audience to understand that the syphilis study was just that. It was a study / experiment for which they had no intention of giving any cure, even though a cure was gotten. You
Correct.
Clearly stated it.
Correct. Case in point. So remember, the Tuskegee syphilis experiment started around 1938-39. They found 300 men with syphilis. They kept drawing their blood for 30 years. They draw their blood. They perform medical examination. Never told these men that they had syphilis. But the worst thing is that by 1948, 1950, the definitive treatment for syphilis was discovered. It's called penicillin. The men were never given penicillin. Had they been given penicillin, they probably could have had the worst parts of their syphilis treated. That was the crime. That was the unethicality. So I'm glad you asked that question in terms of what is the difference, is that we had the treatment for syphilis by 1950. They were not offered that treatment in the form of penicillin.
And the bottom line to that entire statement is that there was a cure, they did not give it. COVID vaccines are preventative measures.
Correct.
And people are not willing to take it. We cannot force anyone to take something, but we can continue the education, and this is why you're here.
Correct.
So I'd like to dialogue with you a little further into diving into this matter some more. So I'd like to deal with the variants, the Delta variant. Why is the Delta variant so much worse than just the regular COVID-19? And are we seeing now, is the variant now taking over COVID-19 as we all know it, and it's now the variant that is really affecting people?
Right. Well, the simple explanation is all viruses, even the cold virus, has variants. And so this is not anything that we didn't expect in the medical community. For example, every year the flu is different. It's a different variant of the flu. But in this case, because COVID started off with what we refer to as the alpha or beta variant, and then once it started spreading, and there we weren't at the stage of vaccinating people for the first, 7 months of the pandemic, the then variant mutates into a stronger, more powerful, more potent, more easily transmissible piece of the virus. So you say, Dr. Ali, what is the difference between Delta and the early COVID? It's more powerful. It's more concentrated. It's easier to spread. That's why Delta has been such a big problem, even worse than the initial versions of the virus. So again, this is part of, we're trained in this in medical school. Viruses mutate. Mutate is just a fancy term for saying that the viruses change, it changes, it gets stronger. It gets easier to spread between humans. So we knew this was going to happen. And the way that you decrease Delta or any other variant that may come along, Lorraine, is by getting as many people vaccinated as possible. Because the more people are vaccinated, the virus can't go anywhere. And after a while, the variant will just kind of die off. It'll never go away totally, but it'll get to such a low level that it won't be disruptive to our lives.
So now we keep hearing the word breakthroughs and long COVID. So long haul COVID. Can you explain to the audience, as basic as possible, what is the long haul COVID and what are breakthroughs?
Sure. Let me take the second one. Long haul COVID is what happens in some patients who've had COVID. So in other words, a patient or a person rather, who has COVID, even though they may have fully recovered, they're still having problems. They're short of breath. They notice that they're not as mentally sharp as they used to. They feel like they're in a fog. They can't sleep. They have body aches. They run fevers every now and then, even though they're, quote, fully recovered from COVID. So they have long haul symptoms. That means their symptoms last longer than a 2-week period when they were really sick with COVID. That is an active area of research to see why some persons have long haul, some don't. We don't know yet. That's going to be studied. We're studying that now. But the significance of long COVID, Lorraine, I would argue is why take the chance of getting COVID in the first place? If you don't get COVID in the first place by being vaccinated, then you don't even have to worry about the long COVID issue because you would be protected in terms of developing COVID. Breakthrough infections, we refer to breakthrough as infections, those who get COVID even though they've been vaccinated. Now the truth of the matter is, even though news media talks about breakthrough cases, they're very, very few. Case in point, we've given out 390 million shots into Americans' arms. There's less than 10,000 breakthrough cases compared to 390 million. Now remember, no vaccine is 100%, by the way. We've been taking shots all our lives, you and I. Polio shot is not 100%, it's like 92%. Measles is not 100%, but it's in the high 90s. So there will be some cases of all these viral diseases. But remember, the reason why we have vaccines is not to make diseases go to zero. It's to get them to such a low rate that they're not a problem for most people.
So, with the breakthroughs, people who get breakthroughs, do they suffer from long haul?
They tend not to because they've been vaccinated. That's the other benefit. So I've had 2 or 3 people that I know very well who've called me within the past month and said, Wayne, I have COVID. I tested positive. All I had was like a runny nose, and I got the test when I went into some place and it turned up positive. And they say, I just feel a little run down, runny nose, body ache for 2 days, and they feel perfectly fine. So the message is, even if you get breakthrough COVID, it's very mild. It's like having a cold for 2 or 3 days. You're not laid up for 2 weeks like the bad cases of COVID during the early part, or with the Delta in patients who are not vaccinated. They're on their back for 2 weeks. Breakthrough cases tend to be very short-lived, very mild. Most people don't even know they have breakthrough cases until they get tested.
That's a very important point, and I'm glad that you have explained that, because I was under the impression, even I, that if there was a breakthrough, then you're going to go through all of these different phases. But I knew that it wasn't going to be as bad.
As bad, right.
But not understanding that you may not have long haul. So that's a great piece of information.
The data show that you're way less likely to have long haul, even if you've been vaccinated and you had a breakthrough infection.
Okay. So now we segues into our vaccine. So the vaccines, are there any long-lasting side effects from the vaccines?
So far, no. And I say so far because even though these vaccines have been fully approved now, at least 2 of them by the FDA, the Federal Drug Administration, we're still studying every day in patients who've gotten the vaccine. So there's what we call clinical trials around the country. For example, I got my shot in January. there are clinical trials of all the people who got shots in January of this year, and they're checked every month to see if something's going on. So we're going to do that. And that's what we do with any vaccine, by the way. Any vaccine given, that you always do what we call post-marketing surveillance. That means you just follow a group of people who've been vaccinated to see if anything bad happens. I can tell you, not much bad has happened. There have been a few side effects that have been reported in the media. Johnson & Johnson had a small percentage of patients who developed blood clots, but they were very simple blood clots to treat. And in fact, the blood clots that you could get from a vaccine are way less severe than the blood clots you get from having COVID. Those we know have killed people. So again, this is called post-marketing surveillance, but the data suggests, again, 300 million shots, 390 million shots just given in the United States, over 500 million worldwide, and we've not seen huge issues in terms of side effects.
So the concerns about it changing your DNA, affecting your fetus if you're pregnant, so taking the vaccine while you're pregnant, the concern with sperm counts lowered, and all of those different, those specific issues that people are very concerned about, your eggs, the female having their eggs tampered with if they take the vaccine. Those are not things that have shown to be true in any kind of way.
No, case in point, we now know that pregnant women who get vaccinated, their antibodies, their protective antibodies from the vaccine are passed on to the baby in utero. So the baby born to a mother who's been vaccinated has some reasonable level of protection against COVID once they're born. I can assure you, Lorraine, my hospital today, we delivered babies. They were conceived sometime in the last 9 months. So there's been no issue with women getting pregnant. There's been no issues with sperm counts. And again, this is part of sometime the inaccurate information. The vaccines have no effect on fertility. They have no effect on the DNA, on our DNA. They have no effect on other aspects of our internal workings. I won't get too technical because they're not invasive. The vaccines put a little piece of the coronavirus into our system so that our immune system recognizes it and attacks it. But when it attacks it, it builds up the body's strength to fight it off in the future. So we've all heard the different. Another question: what are the differences between the vaccines? Well, Pfizer and Moderna are both mRNA vaccines. The best way to describe that is it's just like Coke and Pepsi. They're both colas, right? Pepsi's a little different than Coke, but they still colas. So the mRNA, the Moderna and Pfizer are the same way. They're both mRNA vaccines. One is a little stronger than the other, but not by much. One has a slightly different dosing schedule than the other. So those are simple differences just because there's two different manufacturers. Like I said, we all understand what Coke is, we all understand what Pepsi is. Well, that's the same thing with Pfizer and Moderna. Same type of vaccine, different company, little different dosing schedule. J&J is a third vaccine. That one, as of today, is a one-shot dose. And soon it'll probably be a two-shot dose. Again, a different technology with the J&J. But again, all three work very well. So if you walk into any pharmacy and all they have is Pfizer, all they have is Moderna, all they have is J&J, get it. Doesn't matter.
Right, they all are, well, they may not have the same efficacy in terms of percentage, but they all work.
Correct.
And they all keep you away from the hospital.
And yes, and out of the funeral home. That's right. And that's the key thing. I want to keep people out of funeral home. Yeah.
Right. In closing, health disparities left Black Americans vulnerable to contracting COVID-19 and dying from it at higher rates. In the last 2 months, there has been a sharp increase in the number of African Americans who are concerned that the worst of the pandemic is yet to come. Students, businesses, employees, and homeowners have all been hit hard by the pandemic, with 61% of African Americans concerned about the loss of income related to the current pandemic. As the dangerous Delta and Lambda variants wreak havoc around the world, it is important now, more than ever, to take all precautions to protect yourself and your community. Now isn't the time to give up. As of August 2021, 62% of African Americans are either fully vaccinated or have had their second dose. In closing, as I stated last year, New Yorkers know what it takes to be COVID-free. Wash your hands, wear your mask, and stay socially distant. Remember, COVID is like a thief come to take your most valuable possession, and that is ultimately your life. Above all, be good to yourself and access the NAACP COVID No More guidelines, as it is a great resource. Thank you for having joined us, and enjoy the rest of this convention.
Now, our panelists will present a live Q&A.
So Lorraine, you already have a couple of questions in the chat. But before we get to that, let me just say to everyone that yes, the workshop will be available so that you can post it on the website. It is going to be available in full show, and it also will be available by individual workshop without the commercial. So I know people are anxious to get this information because Dr. Riley should go on the road, okay? Because he was excellent. So Lorraine, I'm not sure if you saw the first question, but it was, what is the doctor's opinion on mixing vaccine shots? And then I'll turn over the rest of the facilitation to you. But if I see any questions that you missed,
Yes.
I'll jump right in, okay?
Thank you so much, Tracy. I really appreciate that.
Okay, you are not unmuted.
You can't hear me? Can you hear me now?
Yes.
Oh, okay, great. Thank you. Thank you, Tracy, for that introduction. And yes, that question is very important. Dr. Riley, thank you for being here this morning. So please, the opportunity to answer the question.
Great. Well, good morning, Tracy. Good morning, Lorraine. Good morning, NAACP community of New York State. What an honor for me to have participated in that discussion with Lorraine and with you this morning. With regard to the mixing and matching of vaccines, we don't have the data yet to say that it works. If you ask me as a physician, I think probably within 6 months that we'll have some new data that will say it's probably okay. But as of today, on October 9th, we don't have the data. So and that's why the CDC has been telling Americans, look, we're looking at if you can interchange vaccines. We just don't have the data to say definitively that it will be okay. Based on the science, I think in the end, it probably will be okay. But again, because we never do things in medicine and science just based on my belief or a belief of one physician or one researcher, we wait to see the data. So in other words, what they're doing now is called a mixing and matching study. They've given a group of patients one vaccine, and then they give them a second vaccine, and then they're measuring their antibody levels to see if the antibody levels are in the good range. So those are called mixing and matching studies. That's what's underway right now, comparing Moderna with Pfizer or Moderna and Johnson & Johnson. And like I said, as of today, we don't have the data. I think we will have it within 6 months. So again, we got to let the science give us the true data before we can make a recommendation on that specifically.
Thank you for that. Now, the next question, I think that many people wonder about this. If you get COVID, and do you develop natural immunity? And do you need to take the COVID shot after you recover from having COVID?
Yes, this is something I'm so glad that somebody asked this, because as you know, there's a very prominent NBA player, I can't remember his name, but he was quoted as saying, hey, I'm not getting the shot because I had COVID and I have natural immunity. He's only half right, only half right. It is correct that after you have COVID, you do have some protection, some immunity. But the problem is, and the data is very clear on this, if you've had COVID, your protection drops off within 2 months after you've recovered from COVID. So that's why the CDC recommendation, my recommendation, anybody who calls me and said, Doc, I had COVID, 6 months ago or 3 months ago, I tell them the same thing: get the vaccine. Because when you add the vaccine to someone who's had COVID, their antibody levels skyrocket. And so they skyrocket, which means they are more protected than if they just relied on short-lived immunity. Remember that natural immunity that people are talking about is short. It will not last you longer than 2 to 3 months. So why take the risk of recovering from COVID and then getting COVID again? Where you can just get the vaccine, and that will greatly mitigate the possibility that you'll get a bad case of COVID, as Lorraine and I discussed on the presentation earlier. So yes, natural immunity is only half of the issue. The other issue, you still need to get a vaccine.
Is that sort of like a booster in essence? If you got
correct, it's almost like a booster, because your body's already been exposed to COVID. Now you get the vaccine, the first two, it boosts your immune system. And that's separate even from the whole booster discussion, which somebody will probably ask about shortly as well.
Yeah. So there's a question about, should someone wait to get the COVID shot if they've gotten a flu shot? Is there a wait period between the two?
No, the data suggests you can get them the same time. Now, what I do tell family members is I tell them, don't get it on the same day. So in other words, if you're the spouse, you get it on one day and the spouse gets it on the next day. And just for the simple reason, sometimes after you get a flu shot, you feel a little washed out. And, you don't want two people in a household, sort of feeling washed out. So that's the only recommendation. But yes, you can get flu and COVID on the same day. In fact, my own wife told me yesterday she got her flu shot and her booster shot for Pfizer on the same day, and she's had no problems.
Mm-hmm. So there's another question regarding blood clots. The question is, so does COVID itself give one blood clots? Because the issues has also been that some vaccines have created blood clots as a side effect. Does COVID itself give you?
Yes, COVID itself. So in other words, a patient who has never been vaccinated, blood clots are a big problem in COVID patients. The reason why it's caused what we call hypercoagulability. I don't want to get too technical, but it makes your blood thicker. When your blood is thicker, it can't go through the blood vessels. It can't get into your heart. It can't get up to your brain. When blood is thick, it's like molasses. We all know what molasses is, and syrup, right? So COVID makes your blood real syrupy. When the blood gets real syrupy, it tends to clot. And the problem with COVID is that it causes clots in your entire body. And that is difficult for us to treat. Treating clots in the lungs, you've heard of pulmonary embolus, right?
Yes.
PE.
Right.
That is a huge clot in your pulmonary artery. You have clots in your brain. We have major blood vessels that go in our brain. You can have clotting there. You can have clotting in your arteries in your legs. So that's why COVID clots are worse than a side effect that you could get a clot from a vaccine.
Okay, so there's a question about Moderna. Will Moderna offer a booster shot?
Yes.
They're working on it, I assume.
Yes. No, the Moderna filed within the last 24 hours, I believe, for approval for their booster shot. So yes, those of you who got Moderna within the past year, and you meet the criteria of being over 65, conditions, healthcare worker or teacher, you will be able to get your Moderna shot, I would suspect, even before Thanksgiving, if not by the end of the month. The FDA is meeting next week to make the formal approval. Moderna has submitted all their data, so we will have a second booster shot within the next month or so. You can currently get a Pfizer booster if you've had the 2 doses and you meet the criteria I just mentioned. And like I said, with Moderna, you will be able to get a booster as well. The other good news is, yes, J&J has submitted their data to the FDA for their booster. So we will have booster shots for all 3 vaccines, I would say by Christmas at the latest.
Okay. There is a question we wanted to deal with in terms of the hesitancy issue. And the question becomes, do you think that distrust between people of color and the government is due to long history, which you did mention, and is the most prevalent issue determining people to get vaccinated. And the second part of the question, how much do the determinants of poverty play into this?
Even when
For
you try
example, lack of transportation.
to suppress it, don't even think about it, or
Someone
just
please mute yourself. Go ahead. Thank you.
Yeah, I lost the last little bit because of the cross chatter. What was the second part, Lorraine?
The last part of it is, how much do the determinants of poverty play into
yes.
this? Example,
Yeah.
lack of transportation, etc.
Absolutely. You know, we call this, the fancy term, we call it the social determinants of health. And all that means in New York State NAACP community is all things we are challenged with in the Black and brown community. It's housing, it's education, it's access to primary care doctors, it's nutrition. Those are the social determinants of health. And then you look at the overlay of chronic conditions that we tend to have in our community: high blood pressure, diabetes, emphysema, COPD, prostate cancer, lupus, sickle cell. Those are pre-existing conditions. So what we know about COVID, the COVID virus is very focused on people who have coexisting conditions. And that's why we've been hit so hard, because of the high rate of of social determinant of health issues, and overlaid by chronic conditions. So that is sort of the bad mix that has led to us having a significant problem with COVID. Now, with regard to the hesitancy, I think the first part of that question was about hesitancy, right, Lorraine?
Yes.
Yeah, the hesitancy, again, as we talked about, look, we have earned the right to be suspicious. But that being said, when there is clear science that could prevent us from dying, we need to embrace it. And, you know, I have spent my career as a physician trying to make sure Black folks get the same quality of care as white folks, no matter how much money they make. And in this case, this is yet another clear example. I can tell you, in January, when the shots first came out, there were wealthy New Yorkers calling all over town trying to cut the line to get the shot. Mm-hmm. If wealthy white folks are trying to cut the line to get to something, that ought to tell us all something, that we need to get in the line too, because we were at the front of the line to get the shots, based on the high rates of chronic conditions in our communities. So again, hesitancy is okay, but hesitancy can be mitigated or understood by following the advice of scientists and people who have studied. Look, I've known Dr. Fauci for 20 years. There's not a finer physician in the country than Tony Fauci. And this man, what he has been able to do to bring these three vaccines, you know, through dealing with the craziness of the Trump administration, is nothing less than miraculous. You can trust Tony Fauci. When Dr. Fauci gives you advice, you can trust it, New York State NAACP. And again, people like me who have studied this, I read the data every week. I stay up on the latest trends. I will tell people things that I know and don't know, but I do know that these vaccines are safe. And yes, it's okay to be hesitant, but don't let your hesitancy, you know, lead you to what I would refer to as a stupid decision for you or your family.
Last but not least is the issue about children under 12 getting the vaccine without reported significant trials.
No, the data are just submitted, I think yesterday, that Pfizer has submitted their data for 5 and up. And so that will probably happen sometime towards the end of the year, if not Christmas. So again, by the new year, 5-year-olds to 12-year-olds will probably be able to get vaccinated. And then probably no later than Easter, we'll have data on 6 months and up on children. The data in children shows that the vaccine is very safe. Now, how did they test it? Well, they took, for example, the Pfizer shot is about what we call 30 micrograms in terms of amount. So they cut the amount that they tested in the children to like 10 or 15, and then they administered to over 4,000 children And then they followed them just like they do in adults. Drew their blood, checked them out, see if there's any problem, check their antibody levels. And the data suggests that it's going to work in kids too. So again, we need to have our kids, black and brown kids, once the FDA approves this, I would highly urge all of us who have grandchildren, nieces, nephews, children who meet the age criteria to get the shot. We all know children tend to be little incubators of everything, right? But this, if we can control the spread of COVID among children, that will help everybody. So again, this is yet another promising development that we are going to have the ability to give vaccination to children as young as 5 and within 6 months as young as 6 months and upward.
Thank you
Well,
for
thank
your
you
time,
very
Dr.
much.
Riley.
Well, Lorraine, I will tell you that this was excellent. Dr. Riley, excellent, excellent information. And what we're going to do, because I know that there are still some questions in the chat, we're going to save the chat questions and give it to our state chair so that she and you can look at the questions and we will get them out to everyone. It was an excellent, excellent workshop, and we want to thank both of you.
Thank you,
this
Tracy. Thank you,
wonderful
Lorraine.
information.
Thank you very much, and be safe. And again, Black Lives Matter, and science matters to Black lives.
I love that. You know, we're going to have that hashtag, right? Okay, thank you very much.